What makes the coalition more fun to work at is actually that there's no precedent, you know? This is sort of a new front line of reform for healthcare, and with that kind of mindset, it feels like I'm exploring new options all the time. I'm trying new things, and it makes it really fun to work here.
The coalition is a group of healthcare providers that realized that they needed a more connected way of working together. And they realized that trying to help underserved communities alone as individual providers does not work. You have to work together.
I came to this fellowship after working in a community health center in North Philadelphia, a somewhat similar community, and in my work with patients just saw a lot of ways that the system wasn't working well for people, and wanted to be a part of addressing some of the systems levels issues. And that's what the Camden Coalition is all about, taking a step back look at the health system, focusing on patients who utilize a lot of healthcare resources, and recognizing that in a lot of ways our system doesn't serve them well, and then working on creative solutions to that. So,
Vision that Dr. Brenner had about changing the healthcare system in the United States, it's been something that I was very interested in, and also where Dr. Brenner came from as a primary care physician in a very sort of low socioeconomic neighborhood. It was something that I really admired, and something I wanted to do when I became an adult. So I wanted to go to a medical school, and basically for that I felt like I lacked the necessary clinical and patient interactions that would help me get into that sort of field. So I was looking around, and this seemed like the perfect place to get into the thick of things, you know.
Mm-hmm. The goal of the collaborative is to make Camden the first city that on a city level improves the quality of the healthcare system and lowers costs at the same time. So that work ranges from teams that are doing community-based case management, care management, support, kind of outside of any of the current medical systems. In other words, we're not replacing the PCP, we're not replacing hospital or specialist care, but we're having teams of nurses, community health workers, medical assistants, LPNs, social workers who meet patients in their homes, in their community, go to doctor's visits with them, and help them navigate the existing system. That's one outreach.